Why are babies fussy? Babies are fussy because they're tight. I'm Dr. Barry Gillespie. I practice in the King of Prussia Medical Center in King of Prussia, Pennsylvania, United States of America. This video applies to families who have a fussy baby and the professionals who care for them. Fussy babies have been around since the beginning of time. Having worked on over 1,000 fussy babies since 1980, I'm here to show you how a fussy baby can become a happy baby. I want to describe the conditions, the fussy conditions that we deal with. We deal with babies who have latching problems, or they have difficulty latching on, or they have difficulty sucking, and they have difficulty swallowing. And we also see babies who have strain where there's reflux, and where they're tight here, where they're colicky. And we see babies who have indigestion and gas, babies who are generally not napping well. We also see babies have some slight misalignment. They have strabismus. We also see babies who have stridor, tightness in their throat. We see babies who have pyloric stenosis, where they're tight between their stomach and their small intestine. And we see babies who have clubfoot, where a foot is turned in, and that could be corrected with our therapy. We've talked about fussy babies. Why are fussy babies fussy? They're fussy because they're tight. And what I mean by tight is their connective tissue or their fascia in their bodies is tight. And I'm saying, you might say, well, what is fascia? Fascia is the connective tissue that holds everything in our body together. It's around all of the muscle cells. Each muscle cell is about the size of a hair. So if you can picture your hair as a muscle cell and the saran wrap layering around it is fascia. So every muscle cell that you have in your body is surrounded by fascia. So any type of muscle that you have in your body, there's fascia with it. If there's any trauma, if there's any birth trauma to this fascia, it becomes tight, it can become restricted, it can become bound down. And this is what we see with our newborns, this is what we see with our infants. So the tightness can extend throughout the body. The fascial web is from head to toe, finger to finger. It's this web of connective tissue that connects everything together in the body. And for professionals, when I was taking my general anatomy dissection in 1969, I remember the professor coming over, and I was working in the abdominal area and the trunk, and he came over and said, well, just cut away that fascia around the heart and the organs, and you want to see the organs, and just cut that away. It really doesn't do anything, and there's no application for it. But we found there is a tremendous application for fascia. And when I took histology, the study of microscopic organs, we studied fascia, the endomysium, the paramysium, and the epimysium, and we all studied these in school, and we all learned these terms for the test, and we memorized them, and we gave them back on the test, and the next week we forgot them because it didn't have any application. Fascia really didn't have any application in the body. It was just a tissue there that just held everything together, and that was about it. But what we're finding is if there's trauma, birth trauma, it can become very tight, and we'll talk about that in a minute. What causes tightness? We believe birth trauma causes tightness, and it'll cause tightness in the soft tissue, in the fascial system of the body. Well, what can happen? Well, if we look at delivery, there's certain conditions where there's a difficult delivery, if there's a lot of pressure, if vacuum suction is used, where the vacuum suction is pulling on the head and can create strain in the head and the neck and the body. If forceps are used to place around the head and clamped onto the head and you're being twisted and pulled out by the forceps, that can create fascial strain in the body. If the cord is wrapped, the umbilical cord is wrapped around your throat or wrapped around your body, it can create pressure in your throat and create fascial strain here and throughout your body, your arms, your legs, your trunk. You can also have strain if you have neonatal surgery. If you're having heart surgery, if you're having any type of surgery done in the first few days of life, any type of surgical procedure invades into this fascial web and creates tightness. And you can also see that with tongue ties, surgery, revision on the tongue tie, revision of the lip tie surgery, and also circumcision. So these are all types of invasions, so to speak, where their soft tissue pressure can be a big part of the infant's problems. Now, to apply that trauma that I just discussed to the infant's body, what can happen is if there's pressure on the head and on the throat, that could be a harbinger of nursing issues, being able to latch on, be able to suck, be able to swallow. And if you can't suck, swallow, and breathe, we see babies who have failure to thrive. And they have difficulty gaining weight, they have difficulty, there's some suck, swallow, and breathe that they have trouble with, and our therapy starts to free that area up, the oropharyngeal area, so they can nurse well. And usually if there's a problem with reflux, you may see strain in their throat or their esophagus or down in their diaphragm right here, or in their stomach right here, and those babies are vomiting, they're refluxing, they're tossing up their food. If we have indigestion and gas, then we're going to see fascial strain down a little bit further along the stomach and the pancreas, and on the right side, the liver and the gallbladder. These digestive organs will be tight, and it'll create an indigestion or a gas. If your baby has constipation, we usually see fascial tightness in the small intestine and the large intestine, down in the bowels. The fascia will be tight here. Also, if your baby has colic, there's usually a lot of pressure, a lot of pain in the abdominal area. The fascia is usually very, very tight here. It may go down into the pelvic floor, and when we feel that, we can feel the strain in the pelvic floor pulling into the abdominal cavity. If we have situations like stridor, there's usually a lot of pressure in the throat, fascial strain right in this area. We also may see laryngomalacia, that goes along with stridor if there's pressure in the throat. A lot of times if there's neck pressure, this fascia in the neck will pull up into the eyes and cause a strabismus, where the eyes aren't in perfect alignment. If one eye is a little bit lazy or wall-eyed, or it's a little bit off, a lot of times we see there's fascial strain from the shoulder and the neck pulling into that eye. If we have a situation like pyloric stenosis between the stomach and the small intestine, usually at that pyloric valve there's pressure, there's fascial pressure, which closes that valve, and when the baby nurses, the chime can't go from the stomach to the intestine, and it just shoots back up through the mouth and creates a projectile vomiting. And with the clubfoot, we believe that the baby has in utero compressive strain, that they were in a certain situation in utero where their foot was turned in. So if we can get to the baby soon enough, the baby's fascia can release and correct, possibly without casting or without surgery. And when we talk about strain patterns, the labor is very important, and and what happens in utero is also important, where there's an actual compressive strain in utero, and it's very, very important. Our goal is for every baby on the planet to be checked for tightness at birth, to see if there was birth trauma creating restriction in their body. So if there was, you would have therapy when you're minutes old. When you're 10 minutes old, you have your first therapy. And all through that first day of your life, if you needed more therapy, you would have it as needed. So you have these sessions over the first 24, 36 hours that you're in the hospital. So you're continually loosening it up. So by the time your family leaves and you go home, you're a happy baby. You're calm, you're relaxed, you're able to nurse well, you're able to breathe well, you're able to digest well, you're able to poop well, and you're able to nap well. You're a happy baby. This is what we want for every baby on the planet. As far as therapy, you might be wondering, well, what do you actually do with the babies? And what we do with the babies is we just hold them and we just feel and we just listen to them. We listen for tightness. And I don't know if you've noticed, but when you have your baby, sometimes they will be laying down, or you pick them up and they will kind of go into a stretch where they just start to stretch their arms and neck, and they go into this twist, and they'll go into this strain pattern. It's actually an old fascial strain pattern they picked up as birth trauma. And what I'm doing is I'm just holding them, allowing them to go into this twist. And I'm following them, and I'm listening to their body, and they may be going into a twist and a strain, and I'll feel the fascia in their body getting very, very tight, and then I'll feel the body release it, and where the body lets go of this strain. And that's the key to therapy. You want to feel the fascia getting tight, but the whole idea of being loose is you want to feel the strain releasing from the newborn's body, and they're getting loose where they're a little bit more relaxed, a little bit calmer. And I will hold them, I can either hold them in their legs, in their pelvis, in their trunk, in their head and neck, and around their throat, up into their face and their eyes. I can go intraorally, where we're holding the TMJ, where we're holding the palates and the tongue and the floor of the mouth. We do a lot of intraoral work with babies who have lip tie and tongue tie, or if they have trouble nursing, where they have trouble sucking, or their tongue clicks, and they're tight. Their fascia is very tight intraorally. So we use different techniques. What we don't do is we don't manipulate the baby. I'm not an osteopathic physician where I'm actually manipulating the baby, and I'm not adjusting the baby. I'm not a chiropractor where I'm actually trying to adjust the spine or adjust the baby. I'm a therapist. And we're just trying to listen to the baby. I'm a soft tissue therapist, listening to the fascia, listening to the fascial strain in the baby, where they're tight. And you can almost literally tell whatever they come in with. If they have colic, they're going to be tight in the abdominal area. If they have trouble breathing, they're going to have tightness in their diaphragm. The diaphragm is this large muscle that separates the lungs from the digestive organs. That's your main breathing muscle. The fascia in there is going to be tight. And you may have a baby that's hiccuping, and that kind of tells us that there's some tightness in the diaphragm. You may have a baby who's coughing a lot. It tells us there's tightness in the diaphragm. So the fascia here in the diaphragm needs to be released. And whatever your baby's coming in with, whether it be throat issues, swallowing issues, general fussiness, I'm looking at fascial strain in the whole body. So when I'm starting with an infant, I usually start down with the feet and the arches and check to see if they're tight, and I'll work my way up through the knees and the legs and the hips, and we'll just check through the whole whole body, and that's what I'll do with a session. I always really try to work in the mother's lap. So baby is in mom's lap, baby's in mom's, up against mom's chest. So mom is always holding baby, and I'm just there as the annoying man or the annoying therapist who is helping them loosen up. I'm not trying to fix them, I'm not trying to cure them or anything. I'm just a therapist trying to help loosen them up from the birth trauma that they've had. They may have had in utero birth trauma, compressive strain. They may have had long labor, where the labor was hours and hours of compressive strain. They may have had a difficult delivery. They may have had the cord wrapped. They may have gotten stuck in their mother's pelvis where they had shoulder dystocia, where a shoulder got stuck and now they have shoulder issues. So there's all kinds of birth trauma here that needs to be mitigated, and we believe the best possible time is in the golden hour. In medicine, there's this golden hour of as soon as there's a trauma, you want to help the body release it as soon as possible. So the best time would be right after birth to look at these babies, to look at your baby. If you're a birth professional and you say, oh, this baby's had a tough delivery and they're not happy because they're tight. And let's help loosen them up. And then that first hour, the first hours of life, so they can go home as a happy baby. So I hope you enjoyed the video, and if you did, if you could press the like button and share it with all your friends, because we want happy babies everywhere in the world. And if you need more information, you can go to my website, GillespieApproach.com. And in that website, you'll see about 500 stories that I've written about happy babies and fussy babies, and you may see your baby in those conditions. Or if you're a birth professional, you can go see and read about what we've done in the last 10 years. If you're interested in training, you can go to our seminar website, Craniosacral Fascial Therapy.com, and you'll see my teachers, Kim Sherlock and Holly Steflick, and they teach the seminars to show you how to do it if you're a professional. We also have a Facebook group. If you're interested in our continuing stories, our continuing discoveries, and you can follow us in that group to keep up with the latest in our work. So again, thank you for watching, and please come join us so every baby in the planet can be a happy baby.